In a situation whereby there is an obstruction of the inferior vena cava, an alternate drainage route is important. Let us have a glance at the azygos vein, its location, route, structures that can be found around it, variations, and some clinical conditions that are associated with it. I welcome you back to Joen Academy. The azygos venous system is located on either side of the vertebral column, and it drains the structures that are within the mediastinum as well as the back and also the thoracoabdominal walls. This venous system consists of the azygos vein and its two main branches, which are the hemiazygos vein and the accessory hemiazygos vein. The azygos vein have two origins, either from the lumbar azygos vein or it could come from the posterior side of the inferior vena cava, which is around the level of the renal veins. It passes through the diaphragm, reaches the mediastinum, and finally empties into the superior vena cava. The azygos venous system has so many connections, which is referred to as the anastomosis, with the inferior vena cava and the vertebral venous plexus. This makes it an important connection between the two vena cava, which allows alternate drainage route in case of inferior vena cava obstruction. It is important that we know that the azygos vein arches above the right pulmonary hilum at the level of the fourth thoracic vertebra, which we can call T4 in short. The relationships of the azygos vein to other structures within the mediastinum is of great importance in clinical practice. So let's have a glance at the relationship of this vein with other structures. The following structures are found posterior to the azygos vein. These structures include the anterior longitudinal ligament, the right posterior intercostal arteries, and the bodies of the fourth thoracic vertebra to the 12th thoracic vertebra. In the posterior thorax, the azygos vein is located posterior to the recess of the right pleural sac and the esophagus. On the medial side of the azygos vein, the following structures can be seen. The first is the thoracic duct, the largest artery of the body, which is called the aorta, the esophagus, the trachea, and the right vagus nerve. On the lateral side of the azygos vein, we will get the right greater splanchnic nerve, the lungs, and the pleura. The azygos vein is also in close proximity to the right posterolateral aspect of the descending thoracic aorta. Pulsation within the aorta may aid venous return in the azygos vein as well as the hemiazygos vein. Let's have a look at the branches of the azygos vein. But before we do that, support Joen Academy with your likes, comments, and clicks on the subscription button. God bless you immensely. The azygos vein has two tributaries, which are referred to as the hemiazygos vein and the accessory hemiazygos vein. The hemiazygos vein is often connected to the left renal vein. It is formed by the esophageal and mediastinal tributaries, the common trunk of the left ascending lumbar vein and the left subcostal vein, and by the lower three posterior intercostal veins. It ascends anteriorly to the vertebral column before crossing the column posterior to the aorta, esophagus, and the thoracic duct at the level of the 8th thoracic vertebra, simply T8. The accessory hemiazygos vein is formed by the veins from the 4th to 8th intercostal space and sometimes by the left bronchial veins. It descends to the left of the vertebral column before crossing T7, where it joins the azygos vein. Sometimes it joins the hemiazygos vein, and in this case, their common trunk drains into the azygos vein. Let's have a look at the variation of this vein. Like we said in the beginning of this video, the azygos vein have two origins. It either arises from the lumbar azygos vein or from the posterior side of the inferior vena cava. This is an indication that the origin and the anatomical cause of the azygos vein are quite variable. Usually there is a singular azygos vein on the right side of the body. However, the azygos vein is occasionally located in the midline, or two independent veins may be present like in early embryonic development. The azygos vein usually originates at the level of the lumbar vertebra, but it may arise further up. The lumbar aspect of the azygos vein can ascend anterior to the lumbar vertebra and pass behind the right cross of the diaphragm, or cross to the aortic hiatus to the right of the systemic hilum. The aortic hiatus is that point in the diaphragm which the aorta pierces the diaphragm. Systemic hilum is just a dilated lymph sac. The common trunk of the ascending lumbar vein and the right subcostal vein joins the azygos vein anterior to the body of T12. Although if the lumbar segment is absent, the trunk may form the azygos vein. It is important we take some moment to think over this information we get on the course of every lecture. Don't just watch through without pausing the video in every interval to think over what you heard. It helps you to remember and also retain the information, alright? Let's have a look at the clinical importance of the azygos vein. One of the clinical relevance of this vein is laceration, or we can call it the rupture of the azygos vein. This vein may be ruptured in a blunt trauma to the thorax, which can happen in a car accident or as a result of a fall from a height. Laceration of this vein usually occurs at the arch, just proximal to where it joins the superior venous cava. Damage to this vein can result in hematothorax, which is an accumulation of blood in the pleural space, and it is usually detected by an X-ray. If this occurs, a thoracectomy is employed to drain the blood out of the pleural space. Thoracectomy is just a surgical procedure which involves an incision of the chest wall to allow the drainage of blood that is collected within the pleural space. Another clinical importance of the azygos vein is aneurysm. Of course, we have a video on aneurysm. Check out our playlist on pathology and watch the video so that you can have a better understanding of aneurysm, alright? An aneurysm of the azygos vein is very rare and usually causes no symptoms. They are usually detected on a chest X-ray as an abdominal mediastinal mass. They can occur as a result of inferior venous cava obstruction, portal hypertension, and congestive heart failure. Surgical intervention is indicated when there is a risk of rupture or pulmonary embolism. Pulmonary embolism is a condition in which one or more arteries in the lungs become blocked by a blood clot. Congenital defect is another clinical condition that is associated with the azygos vein. Although we don't see this often, the hepatic portion of the inferior venous cava does not form during embryonic development, and as a result, the inferior venous cava continues as the azygos vein. What we call this is azygos continuation of the inferior venous cava, or you can say that there is absence of the hepatic segment of the inferior venous cava with azygos continuation. To compensate for this congenital abnormality, the azygos vein dilates in order to accommodate for the increase in blood flow. Like we stated earlier, it rarely happens. It occurs only in 0.3% of the population and is associated with congenital heart disease or asplenia syndromes. Asplenia syndrome is a clinical condition where there is an absence of normal spleen function. Alright guys, I trust that this video will help you in better understanding of the azygos vein. If you have not subscribed to this channel, please subscribe, share, like, and also leave a comment. See you next time. God bless you, God got you, peace.